All right, everyone. So thank you so much for joining us today for this edition of the CHP Spotlight interview series. Today, I'm really excited because I am joined by Dr. Anjali Dsouza. I've been working on my pronunciation there, so hopefully I didn't mess it up too bad. But Dr. Dsouza, she is a physician. She has expertise in a whole lot of different things that we're going to get into at the District Center for Integrative Medicine. And you can find her at dcimedicine.com. So Dr. Dsouza, first off, thank you so much for joining us today.
Well, thank you. It's such an honor to be here. It's really nice to be able to have this conversation today.
Awesome. Well, I'm really excited because I know you're involved with so many interesting things that our audience, our patients have a lot of questions about and have a lot of interest. So, hey, if I can point them to the expert, that's what I'm going to do. So first, I'd love to hear some insights from you. I know that you're an expertise in integrative medicine and functional medicine. I've heard those terms, but I'd love to hear sort of what integrative medicine is, and I know separately functional medicine is, and how is it different from, I guess, more traditional Western medicine approaches?
Yeah, okay, great question. So let's just start by talking about integrative medicine. And I would say, just to give it a little bit of a historical segue here, it used to be referred to as alternative medicine or holistic medicine. And over time, we've kind of been able to put the name integrative medicine on it. And I think this will actually stick in time now. And I would say there's still some variance on how people define this, but I would say it's based on 5 major tenets, okay? Number one is that lifestyle and nutrition are the absolute, foundation of health. Number two, there is kind of an interest and an honoring of the connection between your mind and your body, right? And that can be both what kind of thoughts do you have, but also what does your emotional and mental health look like? How can we utilize the strength of your mind to have a better, healthy body, like neck down, right? Number three would be there is a deep respect and honoring for the body actually has an inclination towards homeostasis. So we actually kind of want to be in balance, but maybe something will get us off of that. And there's an interest in kind of honoring that that's true. And so that goes to tenet number 4, which is instead of kind of slamming the body with like a very strong specific receptor blocker, we want to think about how to incline the body towards health. So it's a little bit of a different angle, right? It's not like, okay, we're very singularly focused. It's like, oh, this is dynamic. How can we push you gently to get you to health by yourself? And then number 5, I would say, is there is a respect for a human, a patient lives in a context, right? So it's not just what's happening biologically, but what's in your mental, emotional, spiritual health, what's in your social context, what's environmentally, toxins, whatever, impacting you. And looking at that total patient, so to speak, is really important. So I would say those are the main tenets of integrative medicine. Functional medicine is it's a branch of integrative medicine. So it's taking all of those integrative medicine pieces, but there are 2 kind of ways that I would say help define it a little further. And one would be functional medicine is kind of like an operating system of how to think about a patient's case, about health generally speaking. And it's using systems. And here it's not like respiratory, gastro, neuro, it's the systems of a certain mechanism. So there's, the communication of hormones, there's assimilation as a major part of gastrointestinal health, but it's not separating the systems of the body, it's thinking about mechanisms. And in doing so, we really want to understand what's called the root cause, right, of an issue. And I'll give you an example here because it'll help make it a little bit more clear, and it'll circle back to your question of like, what's the difference between this and conventional medicine? So if we take the case of IBS, right? So truthfully, it's kind of like it's like a garbage pail diagnosis. It doesn't really mean anything. It's like, okay, yeah, you could have a little constipation, diarrhea, you might have a little reflux. We will treat you based on your symptoms. Okay, if you've got reflux, I'll give you an acid blocker. If you have constipation, I might give you, some fiber. But in functional medicine, we want to understand, okay, why are those symptoms happening? So that could be many things. Actually, 60 to 70% of IBS is actually small intestinal bacterial overgrowth. So there's an overgrowth of bacteria, or it could be low digestive enzymes, or it could be your microbiome is altered, right? Or it could be that gut-brain connection is not connected well. And if you know the root cause, then you can actually treat the root cause and not just manage symptoms and actually get people well in a real wholesome way. Does that make sense?
Yeah, no, I love that idea. It's cool because it really resonates with, I know, the way we try to approach things from a very orthopedic
Sure.
physical therapy standpoint.
Right.
And it's funny, the analogy I often use with patients is it's the equivalent of, you're kind of whacking your elbow against the wall for, extended periods of time, and you can put a Band-Aid on it, or you can try to stop hitting your elbow on the wall.
Yes,
And
exactly right.
so, yeah, so I really love that analogy, and it's cool because I think it really shows a respect and appreciation for just the complexity of
Right.
the human system, and
Right.
how it's so, and how nothing happens in isolation, and there's so many factors that will influence why anybody's having any the experience that they're having. So it's just really cool to see how you appreciate that in a just in the medical field, because it's very typical, where I know for whenever I've gone to the doctor, I'm sure anybody watching this has, you go and you go for a specific thing, you get one specific solution, and we don't really get that answer as to, well, what led to this.
Right. That's exactly right. Or what are the consequences for taking this medication that might help me feel a little bit of relief, but then I'll have a bunch of side effects, or it may lead to this other condition that no one's necessarily going to connect back. And that's not to say I'm super supportive of our regular medical world, and I went to conventional medical school, and I think it's amazing what we can do. But I think the real benefit is when you think about acute versus chronic conditions, right? If I break my leg, I'm not going to show up to an integrative medicine doctor. I'm just not, right? I'm going to go to the ER. I'm going to see a conventional orthopedic. I'm going to get all the stuff that I need to do to feel better. The issue is when you try to treat chronic issues in the acute care model, that's when things get a little less ideal, in my personal opinion.
Yeah, and that makes sense, because you're right. There's a time and place for everything, and just, are you using almost the right, not to simplify too much, but are you using almost the right tool for the job? Like, what's most appropriately designed? And I agree. You're not going to see, if you're having a heart condition, don't come see a physical therapist like me. It's just not going to help you too much.
Yeah.
Yes, no, I appreciate that. So I'd love to. You have such an interesting background in. You mentioned integrative medicine, and then I know on your website it says palliative care, and even psychiatry. These are all, I know, disciplines that I definitely have been guilty of thinking in totally separate buckets, but you integrate them all together. So I'd love to hear how you utilize all those disciplines and any others together to help your patients. That's just such an interesting model.
A mix, yeah. It's a fair and good question. So I would say that, first and foremost, it's kind of like a little bit of a window into who I am, which is I love everything. And honestly, if I could go back and learn something else, I would, but my family would probably like kill me. So it's a little bit a testament to that there's just so many things that I'm interested in. But I would say how that looks in kind of a day-to-day rollout. I'll start with psychiatry, interestingly enough, because I think that this is one of the most important things that I bring to the table, because I think that if we are not emotionally and mentally well, we can never be physically well. We just cannot. And so honoring that and having the ability to look for that actually is something that I feel very grateful for. I also think that part of doctoring or part of healing is to be able to be present with someone in a very deep and meaningful way. And, part of this is maybe just a little bit of my personality, but I think my psychiatry training actually allowed that to become even more honed in as a skill. And looking at that piece with every patient, I think has really allowed better success for outcomes. So that's probably, the psychiatry piece I think is in everything. It's in everything that I do with everyone, even if I'm not saying like, oh, okay, what are your symptoms of depression? It's not, it doesn't show up like that. It more shows up like, okay, where are you in this world? How do you create meaning? Who do you connect with? It's thinking about people on that level. The integrative medicine part is definitely my biggest passion, and it's really what I do every day, and kind of, what I what I spend my time researching in and training myself around. And so that's just, and that's all over my website. That's really kind of what I do. But the palliative care piece, so just to say a little bit about palliative care, this is really a discipline in medicine that was based on trying to help people with chronic severe conditions have the best quality of life possible, right? And so how this dovetails nicely with the rest of it is I'm not dogmatic about holistic care, right? Like I'm not going to ever say to someone, you should take this plant over this medication and, put my foot down about it, because my palliative care background helps me recognize when someone has enough suffering that actually a pharmaceutical medication is what we need to do right now. And then we maybe can pivot to a more integrative medicine model because that's what's going to be best for them long term. But right now, if I don't treat this intractable pain or this depression, let's say, or this terrible abdominal issue, I'm not going to get anywhere, and they're not going to have the energy to do all the lifestyle and nutritional changes that I'm asking them to do. So that's how they all kind of like weave together, so to speak.
Gotcha. That's super helpful to hear, and I know it's probably a very tough question to answer too, because it's so, you're right. There is no black and white, and there's so much gray and just everything in medicine. And I know part of why I love talking to professionals like you that have that appreciation is to hopefully make others more aware that it's okay not to have necessarily a black and white answer, and that you have to sort of integrate multiple approaches into things, and take this, and you can still take the short term view of solving a problem, but with also this long term approach of making sure that things don't continue to reoccur and getting to the root of things. And I love that. I think that's amazing. And I got to imagine from the psychological perspective, during this crazy year plus now that we've been having, has that been something that you've been seeing as sort of people needing more help with in your practice? And have you seen anything different, just out of curiosity, something different in terms of how people have been presenting during the pandemic?
I think what I've just seen mostly, which is going to speak very intuitively to everyone, you and everyone that's listening, is like the isolation has been so difficult. And there certainly has been more mood, depression, anxiety has been so rampant, right? Like so much fear about what do I do or not do? Am I going to get COVID or not? And it's so fair. And I think, I feel blessed to be able to hold that for people and talk to them about it, and also provide support to them if they need it. But it's also, here's like a real world example of, okay, let's say someone's doing an elimination diet, right? They're removing foods that might be inflammatory to them, and they're getting super stressed out, like, oh, I need to take out dairy and take out grains and take out XYZ. And I'm also seeing they're really struggling around COVID and stress. And I'm like, you know what? I'm just going to do one thing. And that's still going to move the dial a little bit, but I'm like recognizing that there's this like huge emotional mental burden, and you have to like find the grace to say, what's going to take us a baby step further, but not like break you down because, okay, I have isolation from COVID. I'm scared about COVID, and now I'm taking 6 foods out of my diet and I don't even have that. I mean, it's like, you got to do the balance thing.
Yeah, no, that's super interesting, and that's a really smart way to approach it, because you're right. You want, I think, and we see this, I know, from a rehab standpoint. If we want to integrate some sort of, let's say, exercise-based intervention, well, we know the body has to have a certain ability to handle the stress of what we're gonna throw at it, so that it can then adapt. And you're right. It's cranked up to a 10. It's the adaptation, the ability for the body to adapt is going to be so much different, let's say.
That's exactly right. Yeah, no, I mean, I think we're speaking the same language here. Yeah.
I love it. That makes so much sense. And now, speaking of just like coping, ways people cope, and I should say in a healthy way, I see that you have, which is not something you see from a lot of physicians. You have a background. You also have some background and experience in yoga and meditation. And what role do you feel like practices, and it could be those two or just anything related, play in someone's just overall health journey?
Right. So I think a few things about this. So many people are lucky enough to have a religious group or a religion that really keeps them grounded in something that's bigger than themselves. But I would say most of us these days don't. I don't myself. And so, partially this was born out of my own experience in my early 20s, like looking for something that allowed this spiritual outlet, but wasn't necessarily religion, because that didn't resonate with me. And yoga and meditation were it for me. And now with my patients, and so I've spent now 20 years kind of studying and integrating myself into those disciplines. And now for my patients, I really find it's a way to offer something that's not religious. So I feel really comfortable, offering it to them. And it allows for moving outside of yourself, because so much of our suffering, I think, is that our culture is very self-oriented, right? Social media, everything that we do, and none of those things are bad, but it's all about balance. And you can get really lost in, again, kind of more of the mental, spiritual kind of depression without having a practice, a path that allows you to connect with something bigger. And so I think on one level, it really taps into that. But even if that isn't what it is for people, I think it's an amazing way to use that whole mind-body connection piece that we mentioned as part of the, tenets of integrative medicine. It's really activating that parasympathetic nervous system, which is going to be honestly helpful for pretty much everything that people come to see me for. So it's like just a nice way to say, here's this thing that you can do that's going to improve the outcomes of whatever it is that brought you to my practice.
I like that approach, and sort of seeing just how it fits into the bigger picture. That's really cool.
Sorry, one more thing. I would say it's a community building exercise, right? I mean, you can do it alone, but most of the time I'm trying to connect people with a community. Here's this community of people that meditates, or here's this community of people that's doing yoga. And that, like the isolation again, and the lack of community is a big part of dis-ease in our world today. So it's just another way to tap into that as well.
Oh, I think that's so smart. I think it's such a valuable, I think, overlooked piece in the health and just not just in anybody's emotional, mental, physical, spiritual health, like you mentioned, because we often think of, and this leads into actually my next question, because we often think of things like, it's pretty common to think of things like diet and exercise. I mean, I think that's most knowledgeable people will first think of those, but we don't think of things like that. Is there anything else that comes to your mind when we say, like, what are some overlooked parts of the overall health of someone's overall health, and maybe and it could be what you see with patients, what you see in the world. I'd love to hear your thoughts on that.
Yeah, sure. So I think it's definitely a little bit of what we were just talking about, right? The community, the spiritual, those are important pieces of our well-being. I would say kind of on a more like medical side, environmental toxicities and the role that those play in people's health is something that is very often not considered. But more fundamentally, what you were speaking about with food and exercise, and this will probably resonate with you, I actually think something that's overlooked is the individualization of those two pieces, right? Because you can eat healthy food and it may not be healthy for your body or your clinical needs, right? And you can do CrossFit and think you're super like fit, and actually based on what's going on with your physiology or your hormones, it may not be the right exercise for you. And I think oftentimes, I'll meet with people and, savvy DMV folks that are coming in, and they kind of are like, well, I exercise really well and I eat really well. And it's true, that's not inaccurate, but it's not individualized to their specific biology, history, medical needs. And when they switch it to that, it's, more profound how their wellness changes.
That's a really good perspective. It's almost like just thinking of that, just customization, and how everybody sort of is their own individual. And
yeah, you're your own litmus test. I'm sure you see this in your practice all the time, right? It's like, it's partially why you don't have the 10 minutes for 10 patients model, and are working with people deeply and individually to come up with plans for them.
yeah, no, I love that. I think it definitely speaks to sort of what I think of, and I almost imagine like how, like, I know we don't, and one good thing we don't see this too much anymore is, I know a long times ago used to be very protocol based. And I think it's great to see sort of some of that shift away from that to looking at people as individuals. I think that's amazing. And speaking of just the way you approach things in your practice, I'd love to hear more about, can you tell us about just your practice as a whole? You know, how does a patient know, like, so I'm supposed to say I could use your help. How do I know whether or not it's appropriate for me to go to your website or give you all a call or anything like that?
Yeah, so I'll say a few things about that. One, I actually take the time out to speak to every person that, if we have availability, to speak to every person that wants to become a patient, because I do think this is an investment in your care and your medical journey. And so I like to be able to comment on, one, do our doctors here, there's 3 of us here, have the expertise to support that person that comes in? And if we do, great. And if we don't, I actually will give out referrals, right, to other clinicians that I think, you know what, this person actually does this better than we do, and you should see this person. But I think of that as a huge benefit that we offer to people, that I will talk to everyone and say, you know, as long as we're taking new patients, like, yes, we can help, or no, we can't. So that's one thing, is that's an opportunity to actually like gut check if somebody wants to come and they're not sure, could I benefit or not? And I would say, generally speaking, if you have been to conventional doctors and maybe even been helped, but you're still just feeling like, I used to feel better in my life, or I'm not feeling as well as I could, or I don't really want to be on 5 pharmaceuticals or 10 pharmaceuticals or whatever it is, right? Like, definitely that's a good clue that we might be able to have something to offer. And then there's a whole separate track of people that come to see us just for wellness. Let's just say they're not, you know, luckily suffering with any severe medical condition, but they want really individualized care that allows, you know, the doctor and clinician to work with a person in a way that doesn't just think about a chief complaint, but is actually looking at, let's do a deeper dive on your laboratory. Let's use advanced diagnostic tests to see, are there things that are starting to change? Because usually any disease state, there are things that happen 5 and 10 years before that we're not looking at, right? Because in the conventional medical model, we wait until somebody meets the diagnostic criteria for something, and then we'll do a bunch of tests, and then we'll do a bunch of images, and then we'll say, oh, you've got this diagnosis, right? Whereas in our world, or what I believe in preventative medicine, you can actually see some of those changes well before the onset of the full expression of disease, and then you can prevent it, right? Which is super cool.
I like that. So it almost sounds like it's for somebody, for a lot of people as well, who want to almost be well as opposed to not be sick, if
That's
that makes
exactly right. Yeah, no, I think that's exactly how I would describe it, right? You want to continue your sense of wellness and longevity, is a whole separate track than someone who is unwell and wants to improve that. But both, I think, are equally valuable and important. And I would say, if we focus more on preventative medicine in our healthcare system, I mean, we would save money, we would have better outcomes, people would be happier and healthier. I mean, you know, when you compare the US to other countries, we're not doing well when it comes to healthcare. And there's a reason for that. Like, we really focus on that acute care model, wait till someone is broken and then try to fix them.
Yeah, I think that makes sense. And you see that so much when, like, I think back to grad school when, you're learning all the cutoffs for every little test and like, okay, if they're 1 below, they're okay. But then if they're 2, if
Yeah.
they're 1 more up, it's like,
They would jump on it. Yeah.
yeah, really, it doesn't make much of a difference. So that's super helpful. So again, for everybody here, it's Dr. Dsouza is at the District Center for Integrative Medicine. They're amazing, highly recommended. And best way to reach you, Dr. Dsouza, is that going to the website, that dcimedicine.com?
dcimedicine.com. We're also on Instagram. Our handle is at dcimedicine. And then through the website, there's a way to reach out specifically to our assistant, Robin, who's incredible, who will walk you through the process.
Fantastic, fantastic. Well, Dr. Dsouza, I really appreciate you taking this time out today to chat. I'm so excited to share this with our audience, and I'm just really appreciate your expertise and knowledge. I definitely learned a lot.
Good. Oh my gosh, I'm so happy to be with you today, and it's been really fun.
Thank you.